Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate as of February 2nd, 2023. This week, I'm going to continue the series that I was doing before to answer the questions, what are the best steps we can take to live as healthy a life as possible? You may recall I covered cigarette smoking and nicotine addiction, overweight and obesity, and sleep. And this week, I'm going to address what should I know about exercise. Now, I have to start by saying I can't tell you what kind of exercise to do or how much to do, because people who watch this video are of all ages, from college students up to senior citizens, very active to those with chronic conditions. But what I want to do is just give you some general concepts to consider, especially for those of you who are early in a program and haven't done a lot of exercise. Now, having said that, I'm not an exercise physiologist, a kinesiologist, a personal trainer, or any other type of expert. I just want to share my thoughts as a public health professional and someone who has a moderate amount of personal experience with physical activity and exercise. Most important thing, before you start any new program or significantly expanding existing program, please consult a qualified health professional. I put this in red because people always ignore this advice, but especially for people of an older age, before you start anything, please talk to a healthcare professional. You need to have a physical exam and make sure everything's fine. First piece of advice after that, start slow and advance slowly. So we all sort of have this idea in our mind, if I push the intensity, I will push the benefit. And there's some truth to that. But if you push the intensity, you also push the risk of injury. So most people will talk about a curve more like this. Start a little bit slower, make sure your body can do what you want it to do, then push it up and find a level that you can maintain. Next piece of advice is accept where you are and start from there. The Centers for Disease Control has a physical activity guide for Americans, which calls for moderate intensity of 150 minutes a week, and then muscle strengthening 2 days a week. And that's great. But of course, there's a lot of variability in that. And what they go on to stress is wherever you are, if you're completely inactive, once you have had your physical exam, reducing sedentary sedentary behavior has health benefits. It reduces all-cause mortality. And what they're trying to say here is even if you can get started with a little bit of a program, you're going to see some benefits. But they say no matter how much time you spend in sedentary behavior, inactive people can reduce their health risks by gradually increasing their moderate to intensity physical activity. And if you're a little bit active but not a lot, the same holds true. You can increase your health benefits from a little bit of increase in exercise. And it says here, there's no threshold that must be exceeded before the benefits begin to occur. So you can, in fact, have benefits by reducing the amount of sedentary lifestyle that you live and increasing a moderate amount of physical activity. The CDC goes on to talk about people who are already active or highly active, and they do say the health benefits aren't always going to get better if you double or triple, but you can keep pushing the envelope a little bit, or at least maintaining where you're at. So next piece of advice, target your exercise to what you want to achieve. Typically people want to exercise for one of three reasons. They want to improve a specific skill. They want to be a better tennis player. They want to be a better rugby player, whatever it is. They want to improve their physical appearance, typically meaning they want to lose weight, and then they want to maintain or improve their health. Typically, though not always, the younger you are, the more you're focused on improving a specific skill. Sort of middle age is a little bit more about losing weight than when you get older. But the reality is these are all intertwined, right? But you want to start with the question, what are you doing this for? And the reason I say that, I remember one time I was in a gym and there was a guy who was a semi-professional bowler. He was always working his legs because that was the exercise he needed to improve that specific skill. If you want to lose weight, there's a different kind of exercise. You may want to push it a little bit more and watch your diet a little bit more, and then maintaining and improving health. But again, these are all intertwined, but it's helpful for you to know what you're trying to achieve with your program. I'm a big believer in not doing just one type of exercise. There's all sorts of ways people talk about the benefits of exercise. And I'm not a pro. I'm not going to pretend I am. But there's stamina, the ability to really go hard for a period of time. There's endurance, the ability to maintain an ongoing level of physical activity, especially important for your heart. There's strength, of course, flexibility. We often overlook that. Balance, coordination, agility, and speed. And there's others. And obviously, if you want to be a better runner, you're going to work on speed. But I'd encourage you to consider working on all of these activities, or at least an exercise program that gives you some of all of them, because that really will help you maintain your overall health. Obviously, eating a healthy, balanced diet is critically important no matter what exercise you're doing or not. The problem here is it's difficult sometimes to find good advice. We all grew up knowing the food guide pyramid. Many people don't realize that it's actually been gone for well over a decade. It was temporarily replaced with another pyramid, now replaced with My Plate from the U.S. Department of Agriculture. And there's still good advice here, but it's not as easy to follow as the pyramids used to be, probably a little bit more accurate. But beyond generally trying to eat a healthy diet, if you have any questions, seek a nutritionist. There are folks out there that are really quite smart about this. In the meantime, you want to balance your diet and your exercise activities. Obviously, if you get ill or injured, if you get injured, seek medical care. There's really two types of injuries you'll get with an exercise program. One is an acute injury. You might twist or an ankle, rupture an ACL or something like that. But the other, which is probably more common, is an overuse injury. A lot of times you'll hear weekend warriors, they blow their knee out with an acute injury, but over time they can also have a chronic injury. Another reason to start slow and go slow. And finally, start slow, advance slowly, just as I said before, but advance, keep pushing it. Even a little increase in what you do can have health benefits, as the CDC said. So what steps can you take to live as healthy a life as possible? Obviously, don't smoke, don't start any nicotine product, achieve and maintain a healthy weight and an appropriately active lifestyle, get enough sleep, and now maintain an increasingly active lifestyle consistent with your physical abilities. Please feel free to share this video or the whole series with anyone who might be interested. As always, I want to thank Derry Young for editing, producing, adding captions, and posting this video. And finally, if you have any questions about what I've said today, any comments, or any other evolving public health issue, please let me know. I look forward to hearing from you, and I want to address the issues that are of concern to you. So I look forward to hearing from you, and until next week, please be well.